So much love for our veterans here, but across the county, they're struggling to get the health care that they need. An inewsouce investigation found that VA administrators are overruling doctors' orders to keep patients in the federally funded veterans health care system. Some veterans are forced to go without care. Others have racked up huge amounts of debt by paying out of pocket to go out of the VA network. inewsource has been following this story now for months. And joining us now with more details is reporter Jill Castellano. Thanks so much for joining us here, Jill.
Thanks for having me.
Yeah, so dive into this a bit here. Why is the VA trying to keep patients within their healthcare system?
Well, I've reviewed thousands of pages of medical records, internal manuals they use to train their staff. It seems pretty clear there's a budgetary concern here. When the VA sends a lot of patients outside the healthcare system, they're on the hook for paying those bills. But also that means there are fewer patients going to their doctors and their own hospitals. And in the long run, that could mean there's less money for their own hospitals and doctors, and that could be bad for their bottom line.
Gotcha. That's what it's all about, right? The bottom line in a lot of these cases. So, we know San Diego, look, it's home to 250,000 veterans here. So veterans watching this show right now, how does this whole investigation, what you guys are revealing, how does this impact them?
It can have a huge impact. I'll just give you one example of the dozens of veterans and caregivers I talked to. Amy Warricks is a caregiver full-time for her husband, John Seymour. He's a former Navy combat engineer. They live all the way out in Warner Springs. That's in the corner of the county, an hour and a half away from the VA hospital. So they should qualify to get their treatments closer to home, which is good because John Seymour has a really bad spinal injury and it's hard for him to take those trips. But it's really hard for them to get their health care outside the VA network. They waited 7 months for him to get renewed therapy appointments, and they're still waiting for a treatment plan for his seizure condition.
Wow. And again, that's just one of many stories, right? So veterans, they've been hit hard by this pandemic. So how has this development and what you guys are bringing into light here, how has this affected those folks who've had a rough ride over the past year and a half?
It absolutely has. I mean, there has been such a backlog inside and outside the VA when it comes to getting the health care that you need. The VA canceled 20 million appointments over the course of COVID-19. So it's as important now as ever that veterans can get their care when they need it, as soon as they need it.
They're spending a lot of money, right, to go out and in some cases just go to other doctors out of network, and potentially they're spending everything they've got, right, to get the care they need in some circumstances. Is that what you found with some of the veterans?
Yes, some of these veterans are paying out of pocket. I spoke with one veteran who has paid more than $30,000 out of pocket. Her credit cards are maxed out now. She really has nowhere else to turn. So she's relying on the VA and really begging the VA to get the care that she needs.
Have you guys been able to chat with the VA at all about this and what they're planning on doing about it and what they can confirm? What is their take on this whole thing?
Yes, absolutely. They say that they provide high quality care, and there's no question that they do provide high quality care. So they think it's a good thing for veterans to stay inside their network. Unfortunately, for some veterans with really complex medical conditions, the VA may not be the right place for them. And that's the concern these veterans have, that the VA just isn't offering them the best care for their specific needs, and they're better off going somewhere else.
A lot more you guys have developed here too. So where can people learn more about this investigation if they have any other further questions?
They can go to inewsource.org.
Jill, thanks so much for your time. Really appreciate it.
Absolutely.
Thanks for coming on here this morning.